Our next speaker is Denise Gabrielson. And Denise is what Katie and I like to say, she's our star dietitian. We love Denise. She's a media maniac. She's just amazing. So Denise is a registered dietitian at St. Michael's Hospital. She has worked in oncology since 2007 and provides nutrition care to patients receiving treatment for gastric, colorectal, breast, lung, and hematological cancers. Wow. Her research interests include nutritional and inflammatory status in patients with gastric cancer and the role of nutrition screening to improve access to care during cancer treatment. Denise Gabrielson.
I'm just going to set a timer on my watch because as a dietitian, I feel a little bit responsible for getting you to lunch. Okay. So thank you to Teresa and Katie for inviting me back this year to talk to you about nutrition and stomach cancer. I'm going to give you a few tips on navigating some common nutritional problems that can occur with chemotherapy and surgery, and also answer a couple of questions that often come up about nutrition and stomach cancer. For those who attended last year, this may be a bit of a refresher, and for those who are new today, I hope this helps to give you a starting point in navigating your nutritional health. So nutrition and eating well is important in preparing for treatment, whether chemotherapy, surgery, radiation, or all of the above. It's important for recovery, survival, and also secondary cancer prevention. Eating well helps to maintain strength, maintain body tissues such as muscle, and helps to rebuild damaged tissues. It protects against infection and can also help to manage side effects. There's also research showing that people who stay well-nourished are better able to maintain their chemotherapy schedule or have fewer delays in their treatment and also have fewer complications from surgery. Good nutrition can also optimize quality of life, and that includes physical, mental, emotional, and social health. So where to start? Each person has their own unique route leading to diagnosis. Nutrition goals and challenges may differ depending on what you experienced leading up to your diagnosis and where you are in your treatment plan. While my talk today isn't enough time to go in great detail on diet recommendations for each stage or each challenge, I will provide a brief overview of some of the more common ones. The general recommendation before, during and after treatment is to follow a healthy diet, but it's important to acknowledge that needs and abilities may be different at various stages of treatment and recovery. What one perceives to be a healthy diet may not be always the best tolerated diet or the most appropriate diet with the challenges specific to eating with stomach cancer. It's important to be flexible in order to be able to work around roadblocks with eating that can be common with stomach cancer. The best thing that you can do is eat as well as you can. Chemotherapy can be given prior to surgery, after surgery, or may be given to keep cancer under control. The general nutrition goals during chemotherapy are to maintain nutritional status, so maintaining a healthy body weight and muscle mass, optimize symptom management and quality of life, and to optimize treatment tolerance or minimize treatment interruptions. There are a few roadblocks to eating well during chemotherapy, and these include some of the common side effects associated with chemotherapy, and those are loss of appetite, nausea, vomiting, constipation, diarrhea, reflux, feeling full quickly, taste changes, sore mouth, fatigue, sensitivity to the smell of foods, and weight loss. While not everyone experiences the same symptoms or the same severity of symptoms, people who have more symptoms or greater severity of symptoms have a higher chance for having trouble maintaining their weight and nutritional status. During treatment, a dietitian in conjunction with your healthcare team can help you address these nutrition challenges and help you stay en route with being well-nourished. Nausea and feeling full are two of the most common symptoms that can make eating difficult and lead to weight loss. Try to eat when you feel your best and eat whatever food you feel you tolerate the best. So if you tend to be more nauseated in the evening, try to make the most of breakfast and lunch and maybe take lighter meals or snacks in the evening. If you focus on whatever foods you tolerate the best, you may not feel that your diet is the most balanced, but you can get back to your baseline once the nausea resolves. Avoid food and smells that bother you. So if possible, have someone else do the cooking to avoid the food odors and being turned off of the meal. If that's not possible, focusing on room temperature foods or foods that are served cold might be tolerated better. Take time with eating, and if you don't have dumping, which I'll touch on in a little bit, stay upright an hour after eating, and that can help to prevent nausea. Eating small meals or snacks throughout the day are often easier on the stomach and can also help to sneak in extra calories and protein when you're having trouble with volume of food. And focusing on having liquids between meals rather than having with meals can ensure that you don't fill up on low-calorie fluids and not have any room for your food, which is going to provide the most of your nutrition. Fatigue is another very common symptom that may start before treatment even begins, may worsen during treatment, and for some can persist long after treatment. Worrying about what to eat and how you're going to prepare it is often a big burden on top of other symptoms that you might be facing, like low appetite. Some navigational tips include stocking the kitchen with easy foods that are well tolerated. Preparing large batches of meals and freezing in small portions not only takes the pressure off of having to cook every day, but also allows you to rotate through different types of meals depending on changing tolerances and changing preferences during treatment. Keep meals simple and preserve your energy. Sitting at a kitchen table versus standing at the counter for prep work can help, and also relying on pre-cut foods or pre-cooked, canned, or frozen foods can also take some of that burden away. One pan or one pot meals can take some of that hands-off cooking time down so that you don't have to stand at a stove, and also make the cleanup easier. And also we have quite a few meal delivery services available these days, or considering asking for help and maybe getting a meal train going from family and friends. Nutrition challenges definitely have some overlap between chemotherapy and surgery and radiation. So I'm going to switch gears to surgery, but many of these tips are also useful during other stages of treatment and recovery. So the recommendation after surgery is early reintroduction of eating, but to begin cautiously and increase food intake according to individual tolerance. So not everyone is able to do this, but we encourage people to try, and if people aren't meeting at least 60% of their requirements by about a week after surgery, then we might consider other methods to help get enough nutrition in. So along with early reintroduction of eating, nutrition goals are to gradually increase protein and calorie intake to meet requirements, and to maintain or gain weight. And another long-term goal is learning to eat again. And this is going to take time and a lot of trial and error. And similar to chemotherapy, the goal is to optimize symptom management and quality of life. Weight loss is a big challenge or roadblock, often before and after surgery. And we've heard from 2 survivors, and I think there was a 22-pound weight loss after surgery and 40-pound weight loss after surgery. So this can be due to a number of nutritional complications after surgery, including decreased food intake, malabsorption, or not being able to digest or absorb nutrients from the food that you are eating, fast intestinal transit time, dumping syndrome, slow stomach emptying, and some people also have lactose intolerance. Dumping syndrome occurs in about 15 to 70% of people after a partial or total gastrectomy. Symptoms are most prevalent in the period right after surgery and typically lessen over time. Dumping is due to a loss of stomach storage space. So normally when you eat food, your stomach does a lot of work mixing that food with enzymes to start the process of digestion and releases that food in very small amounts into your intestines for further digestion and absorption. So without this storage space, large volumes of food that's only partially digested are ending up in your intestine, and these can lead to symptoms such as diarrhea, fullness, cramping, vomiting, weakness, flushing, dizziness, and sweating. Early dumping usually occurs about 15 to 30 minutes after eating, and there's also late dumping, which occurs 2 to 3 hours after eating. And both of these types of dumping can be exacerbated by high sugar content of food and fluids. Dietary changes are typically the main approach to managing dumping syndrome. Some general tips to manage dumping include eating 6 or small meals per day, so that's releasing smaller amounts of food into the intestine at once. Eat slowly and chewing thoroughly so that you're not putting big pieces of food for your intestines to deal with. So you're kind of doing that pre-digestion in your mouth. Sit upright while eating if you can, and avoid or limit high sugar foods. Limiting fluid intake at meals, including protein with each meal, and choosing high fiber foods when possible can also slow GI transit time or how fast things are emptying into your gut. Weight loss. So weight loss occurs in more than 70% of people with stomach cancer. Severe weight loss is linked with a weakened immune system, longer healing times, more difficulty with side effects from chemotherapy, more difficult recovery from surgery, and limited ability to do regular daily activities. It's also associated with lower quality of life and also challenges with body image. Some general tips for preventing or managing weight loss include avoiding unnecessary diet restrictions. So I encourage you to have a dialogue with your dietitian or healthcare team about nutrition information or special diets that you may hear about or read about, or even diets that you're following for the management of other chronic conditions, particularly if you're already having issues with eating and having issues with weight loss. We may be able to liberalize things a little bit and encourage you to be more flexible with the diet. Eat small, frequent meals using high-energy, high-calorie foods. Small meals are often more manageable, but since the volume is lower, you really want to make every mouthful count. Eating every 2 hours can definitely feel like a chore and feel like that is all you're doing all day long. Changing your eating environment, listening to your favorite music, using a distraction like the television can sometimes take the chore out of eating or make it less of a task that you're completely focused on. Limiting low-fat and low-calorie foods most of the time, and pair them with higher calorie, higher protein foods. So example, if you're having a snack of fruit, pairing it with something like a high-fat yogurt or a handful of nuts will make that more nutrient-dense. If you feel full early, don't fill up on low-calorie foods at the beginning of your meal. So prioritize the high-calorie, high-protein stuff first, and then if you have room, you can focus on some of the lower-calorie items. And you may not have hunger cues after surgery, so relying on other cues to remind you how you're eating, or when you need to eat, or eating by the clock and setting reminders to eat more often. If you are losing weight, it may seem that you need to increase the volume of food eaten in order to get enough calories and protein. By making small changes to the types of food that you're eating, you can actually increase your calorie intake without significantly changing the amount of food that you have to eat. So this is an example of how to modify meals and add extra calories and protein. I just want to mention that it's not a complete meal plan. It's definitely missing some fluid, but it's just for illustrating some strategies that you can use. So if we take a look at breakfast, we can see that making a small change, like changing the 1% milk to whole milk, adding a little very small volume of cream, a little bit of maple syrup for flavor, and half a banana can significantly increase the calorie content. Similarly with snack, there we go. Changing the yogurt to 2% yogurt, adding a very small portion of chopped nuts, or if that's tough for you, you can use ground nuts. At lunch, for example, adding half a tablespoon of olive oil to your chicken soup won't really change the taste or texture too much, but it'll add a good amount of calories. Switching out a full-sliced turkey sandwich, which tends to be low-fat, to half a roasted chicken sandwich, and you can use pre-cooked chicken to make it easier, and adding some higher-fat items like avocado, mayonnaise, pesto, and then again, changing that low-fat dairy can increase your lunch by over 100 calories. Adding some cheese or other high-fat items to the snacks, like cheese with crackers or peanut butter with a slice of bread and no added sugar jam. And then with vegetables, so not saying that you need to avoid vegetables, but make them count. So you can add a little bit of olive oil, some sliced toasted almonds to your vegetables, and then adding condiments like sour cream and butter to a small baked potato. And with these small changes, we've almost doubled the calorie intake to 2,097 calories and increased the protein intake to 97 calories. Information on diet and cancer may come from a variety of sources, including your healthcare team, government agencies, family and friends, support groups, as well as the internet, news reports, and studies. It's important to read information carefully and look for red flags such as use of the words miracle or breakthrough, and the use of anecdotal evidence and testimonials and too good to be true claims. The progression of nutritional science is very slow, and best practice relies on more than one study showing similar results rather than the results of a single study. So it's typically not a good idea to make changes to your diet or restrict certain foods based on the results of one study or news report. Having a few reputable sources of information can help to decipher often conflicting messages we receive about nutrition and cancer, and I've got a few resources listed at the end of my presentation. One of the most common questions that comes up is, does sugar feed cancer? So all cells use sugar as a fuel or energy source, and these include healthy cells as well as cancer cells. Sources of sugar include any carbohydrate-containing foods, such as fruits, vegetables, whole grains, and dairy products, which we know are good for us, and other sources with added sugars, such as sugary drinks, candies, cookies, and cakes. At the current time, there appears to be an indirect connection between sugar and cancer. So we know that high sugar foods can lead to excess weight and body fat, and that in and of itself increases risk for cancer, including stomach cancer. High sugar foods are also low in fiber and other nutrients and may displace nutrients that can have a protective effect on cancers. So the bottom line is, if you are eating well or eating a normal amount, and if you are at a healthy weight, it's reasonable to limit added sugars in the diet. Another question that comes up is whether you should take supplements. So eating a varied diet is really the best way to get all the nutrients you need, but as we know, sometimes treatment, so chemotherapy and surgery, can affect your ability to obtain enough nutrients or to be able to absorb those nutrients effectively. If diet is limited, a daily multivitamin containing no more than 100% of the recommended daily allowance for nutrients can help meet essential vitamin and mineral needs. And I would just say to be cautious with supplements that have amounts of vitamins and minerals way beyond the recommended daily allowance, or with unusual ingredients, as often these can interact with treatment. Some vitamins and minerals of particular concern after a partial or total gastrectomy are iron, vitamin B12, and folate. So iron and B12 require stomach acid in order to help them be in a more absorbable form. And without a stomach and stomach acid, this can be a problem. Bone health is also of a particular concern long after a gastrectomy. So there may be a higher risk for osteoporosis and bone disease due to a lower intake of calcium-rich and vitamin D-rich foods or restriction of lactose-containing foods, and also due to changes in absorption or metabolism. So those are two supplements that you might want to have on your radar. There is an increasing interest in probiotics in supporting gut health. At the current time, little is known of the effects on a partial or total gastrectomy on gut microbiota or the community of bacteria within our gut. While there may be some benefit in managing some symptoms with probiotics, there are no recommendations for probiotic use in gastric cancer at the moment. People receiving chemotherapy should typically not be on a probiotic supplement due to an increased risk for infection. However, supplements are not the only way to support good gut bacteria. So foods such as kefir, tempeh, bananas, tomatoes, whole grains can both provide probiotics and prebiotics, which is the food for your good bacteria. And it's important to speak with your healthcare team before starting any vitamin, mineral, or natural health product supplements, as some could negatively affect the efficacy of your chemotherapy. And I'm just going to end on a slide of the recommendations for the American Institute for Cancer Research for reducing cancer risk or risk for recurrence. It's a good place to start when thinking about healthy eating after recovery, after cancer treatment. A few things to note. It says after a cancer diagnosis, follow our recommendations if you can. As I said before, it's important to be flexible to meet your nutritional requirements. I've given some tips on where to start with navigating your nutritional health, but everyone is different. Everyone experiences their own detours, and a roadmap that works for one person may not be the best route for you. Healthy eating may need to be adapted to your individual needs, and symptoms that can affect your ability to eat may be worse right after treatment, but will lessen over time.